Oh, hey, Dr. Amy here. It's been a while since our last coffee talk. I'm outside, beautiful weather, drinking out of my BFF coffee mug. But things have been going well, weather's been nice. But wanted to hop on here and get a little bit of coffee talk going on, and wanted to huge pet peeve of mine. I had a patient. I'm going to talk about a little patient today. Okay, it'll be quick. But patient came in to me earlier this week, and she's in her early 40s, and she had knee pain, spontaneous knee pain. And then her knee spontaneously swelled up, okay? She couldn't move her knee. This was like about 2 weeks ago, prior to her seeing me earlier this week. So she couldn't bend it at all. So she went to urgent care, okay? Because she couldn't get in anywhere else. Because she thought something was wrong, right? I mean, swelling randomly shows up, can show up randomly. Can't walk on it, can't fully bend. Oh my gosh. As someone who's experiencing this, it's like, oh my God, what did I do to my knee? I've just been back squatting and doing fitness, and this particular patient, she is an avid CrossFitter. She's fairly well in shape. Anywho, goes to urgent care. The ortho or the PA that's on call, they do an x-ray, because that's standard. Nothing's wrong with it. Structurally, there's nothing wrong with it. Okay. Clearly, there's swelling in her knee because she can't bend it. So they wrote a prescription for some NSAIDs to help decrease the swelling. Here's this 30-day pack of NSAIDs. Go do your thing. Don't do any squatting. Don't exercise. See how it goes. Just sends her off. Well, the patient was... this patient had to, she already had a pre-planned family gathering, so she was out of town for a whole week. In fact, was supposed to go skiing, but she couldn't, so she bought herself a brace, just to kind of create some stability into the knee. Well, she reached out to me right before she went on her vacation. And thought, maybe I should have a physical therapist look at this. Right? So, got her on the schedule, hence earlier this week. Comes back from her vacation, she walks in with her knee brace, fully weight bearing, like she's cool. She's like, yeah, the swelling's down, it's better. I'm just so scared to squat because that ortho who was there told me not to squat, not to exercise. I just want to get back to exercising. And we were talking, and I was listening to what she was telling me, and she's just like, it just kind of hurts when I bend the knee still, but I have full range of motion. I can walk. Don't think I can run. Don't think I can do a single leg squat, which in the CrossFit world we term that a pistol squat. And so I was like, oh, okay. Well, I'm already thinking, I beg to differ. Let's see if there's anything structurally wrong. So I assess her, all that. And in fact, needless to say, at the end of her session, she was able to do a pistol squat without pain. So, moral of the story. When you get an episode of pain or a bout of maybe swelling in the joint, yeah, that's okay to reach out to an orthopedist or urgent care of some sort. But the thing is, as a healthcare provider, you have to care. Words affect patients. This patient, who is pretty fit, she exercises daily, she has 4 children under the age of 10, being told not to be able to do something made her think, oh my gosh, I'm scared to squat, I'm scared to stoop, I'm scared to jog, right? Because she thinks she might jack up her knee a little bit more. This is where physical therapy steps in. The general public, unfortunately, doesn't really know or is aware that physical therapy 9 times out of 10, when you experience a bout of pain, physical therapy can help assess that and get you better. So that patient came in, I had her doing pistol squats at the end of her session. It only took me 40 minutes for her to do a pistol squat. And then she texted me the next day, hey, I did tempo back squats. Knee felt great. I kept my load a little bit lower, and we'll see what I feel the next day. So I need to follow up with her. But, so, you know, as a healthcare provider, words matter. And we have to try to put ourselves in that patient's shoe, right? So that drives me nuts. You know, a patient comes in with about a pain. Of course, they're going to seek out their physician first, and usually the steps are get an x-ray, here's some medicines, don't do this. I'll see you in a couple weeks after you finish with your dose of medicine. No mention of trying to regain function, trying to really hone in and assess the pain or something that is limiting that patient or the range of motion in order to get that patient or that person back to doing life again. It's like, oh, I'll see you later. So I'm so glad that patient reached out, because within 45 minutes, we got her back to being pain-free, doing a single leg or a pistol squat with some assistance. And then the next morning, actually right after her session, she did a CrossFit workout. So a lot of education. I love education. And it's all about keeping the patient in the game and decreasing that fear to get back into the game, right? So it's kind of like you got to get into the shallow water before going head deep. So, yeah, just know that physical therapists are out there to help regain function for something that you maybe are missing out on doing, right? Maybe it's getting back to riding that cycle again, right? Cycling outdoors, it's getting nice out. Or CrossFit. Or maybe it's mountain biking or jogging or a 5K or a half marathon, right? This is bridging the gap between injury and functional fitness. And this is what Fortress is here to do. So just some thoughts to kind of shout out there. Yeah, so don't let pain hinder you from what you're doing. Seek out professional help, and physical therapy can help you with that. But if you're in the South Charlotte area, come check us out. Got some awesome grog coffee from back home in my BFF cup. Salute on this lovely, almost spring day. And we will talk to you guys later. Reach out if you have any questions, comments. I'll be glad to help you guys.